Hello, Dr. O'Shaughnessy. I'm Donna Myers.
Okay.
I'm the behavioral health clinician that's working from management in this department in primary care on a change in our approach to interacting with patients called motivational interviewing. I know recently you attended a presentation on motivational interviewing, and I'd be really interested to know a little bit about what your thoughts were about motivational interviewing.
I appreciate the thought and the idea behind it, but I don't have that much time with my patients.
I think I hear there's a big challenge here that from what you learned about motivational interviewing and what your experience is interacting with patients, motivational interviewing may be challenging because it seems like it'll take more time than what you've got.
Mm-hmm.
Yes. What did you like about motivational interviewing, regardless of the time? What did you like about it? Anything?
I like the idea of getting to a more personal level with my patients. I did like that part.
I think the part you're referring to then is establishing rapport, understanding your patients, how they live, what their personal life is like, what their troubles might be, what their challenges might be, and what their successes are, so that you can relate to them other than just on healthcare.
Yes.
So, establishing rapport, which is something that clinicians are very, very familiar with, is something that you feel is successful already, and you liked motivational interviewing for emphasizing that rapport building.
Correct.
Good. Okay, that's a good place to begin.
Mm-hmm.
Um, does establishing rapport challenge the amount of time that it takes to see your patients?
I feel it does. Yes.
What do you do to overcome that right now?
I get to know them as best I can in the short amount of time that I have with them, but my primary concern is why they're there to see me.
Okay. What tends to happen after you've seen your patients? Do you have some that you see again and again, or some that you don't ever see again, or what's the difference?
I see some all the time, and sometimes I don't see them again. So it just depends.
Okay. Those that you see repeatedly, what's usually going on for them?
They typically have chronic health issues.
Okay. So those that have the more longer term healthcare needs
Mm-hmm.
and issues, have you been pretty successful in interacting with these patients, making changes for them to be able to better take care of their health?
Sometimes I don't feel like they totally are responsive in the short amount of time I have in explaining them, what they need to do.
Okay, okay. So as you're trying to give them some direction on
Mm-hmm.
what needs to be done and what needs to change,
Mm-hmm.
they may not be as receptive to that, or they're not maybe listening so well or hearing what you have to say.
Mm-hmm.
The times that the patients are successful, what's different?
They typically take a little bit more responsibility for their own health. They're a little bit more um, proactive rather than reactive.
Okay. You know, and when you heard about motivational interviewing, that's another one of the processes that's really very important, which is kind of getting focused on the same goals.
Mm-hmm.
So those two processes are part of motivational interviewing. So that first step, that relating to the patient, establishing rapport, that's kind of where we're going to begin. And I need to hear from you as much feedback as I can to make this possible for you to do it in your sessions in a short period of time. And then maybe we can move on and you can achieve even more success with those patients who are goal directed and focused.
Yes.
Thank you.
Mm-hmm.